Dr. Al-Salihi from the Muthana University in Iraq, and Dr. Muthana has a PhD in equine internal medicine, but she's moving to camelids to report on a study of tuberculosis in camelids in Iraq. It should, yep, you're on, and that moves on. Just press once, and the pointer is here. So it's up here. Karina?
Okay, very good morning for everyone. My presentation is under title Study of Tuberculosis in Camelids in Al-Muthana government in Iraq. It's the presentation overview, introduction, camelids, TB, what is the problem, materials and method, results and discussion, conclusion, and some questions if you want. Introduction of the camels. Camels is a common name for large-humped, long-necked, even-toed ungulates comprised mammalian genus Camels of the Camelidae family. The camelids are not ruminant. They are polygastric animals, but not a true ruminants, according to Fowler, 1996. True ruminants have 4 compartment stomachs, whereas there are only 3 compartments in the camel stomach. Estimated population of camels in Iraq, around 67,000 camel in Iraq. The greatest portion of this population presents in the middle, south, west part of country, and most of these animals are kept by pastorals and nomads, and they are used for meat and also for milk, and there is also traditional use of whole milk. They are used for the treatment of the diabetes patient. Also, there is starting some camel races, and also a growing export trade. This is the map of Iraq, and this is one of our visit to the deserts where there is the camel there. And this is the most areas where the camels is present. The most population is present in Samawa and Nasiriyah. It's in Al-Muthana governance, and there is a little bit there, and also there is a few population in Baghdad, the capital of Iraq. Camelids TB, what is the problem? TB is a complex infectious zoonotic disease of animals and humans. It is a chronic contagious granulomatous disease caused by mycobacterial species belonging to Mycobacterium tuberculosis complex. Have a wide host range that complicated the epidemiology of this disease. Previously, and this is very important notes, there is a belief that camels are resistant to most diseases, but this is not the truth, because the camels out of reach of the veterinary service, that they are believed that it is resistance for the disease. So in recent years, camelids were not considered highly susceptible to tuberculosis, but in recent years, an increased number of cases have been experienced in some countries. Both the New World camels, Lama, Alpica, and Viacona, and Old World camels, which is a bacterian 2-hump camel, and 1-hump camel dromedary, are susceptible species to these pathogens. Although the extent of TB has been well documented in humans and most domestic animals, very little is known about the pathology and causes of camels TB in pastoral area in the world. Mycobacterium tuberculosis and Mycobacterium bovis and typical mycobacterial such as Mycobacterium kansasi and Mycobacterium equi are all the causative agents of camel TB according to Keen et al. 2006 and Al-Musalami 1971. Camel TB has been reported in Egypt, Rafi 1992, and also in United Arab Emirates, Werner Kidney 2002, and Kini et al. 2006. In Pakistan also was recorded in camels, and also in Australia. In Iraq, no previous reported indicated the existence of camel TB. Aim of these studies. The present study, therefore, was intended to focus on the pathology of camel TB and identify the causative agents using molecular tools. Materials and methods, we did 2 studies. The first study is a preliminary studies, and according to the request of one owner of the camels, According to request of the owner of one camel, the clinical examination was done for a herd of camel at November 2014. A few camels were showed the following clinical signs: changes in behavior, anorexia, coughing, respiratory distress, and death occurred due to some poor condition of the body condition of the camels. We did the comparative tuberculosis test for 10 suspected camels, and the thickness of the skin was measured immediately before and 72 hours after doing the tuberculosis test. As a positive result is indicated by an increase in the skin thickness at the bovine size that is greater than the increase in the avian size. And actually, in this, at this point, we stopped this study because the owner was conflict with us because after the positive results, and we stopped this study. That's why we move another choice. Another option for our studies is this is the tuberculosis test. We did the tuberculosis test in this area, and we measure the thickness. And we move to the second studies. Animal studies, cross-sectional studies was conducted on 50 apparently healthy camels, male 25 and female 25, slaughterhouse in Al Muthanna Epitor along years 2015. For each animal, post-mortem examination was done for each animals, and mandibular retropharyngeal lymph nodes and the suspected lesion on both left and right lungs were sectioned, inspected, and palpated carefully. Whenever gross lesions suggestive of TB were detected in any of the tissue was classified as having lesion. Affected tissue, where we collected the affected tissue and we fixed it in 10% formalin solution, buffer formalin solution, and routinely processed for histopathological evaluation. And we sectioned the formalin after histopathological processing. We sectioned the tissue, and then a direct smear also were made from scraping of the cut surface of 24 suspected tuberculosis lesion, and stained with acid-fast stain or xenolsin stains. Then mycobacterial isolation. We culture the tissue on the Lowenstein-Jensen media, on duplicated slants, on enriched with sodium pyruvate and the other enriched with glycerol. Culture were incubated at 37 centigrade for 8 to 12 weeks with weekly observation for growth colonies. And mycobacterial genus typing, we send it for South Korea for PCR studies. And then this is the primer they use for using for PCR. And now we have the results for the preliminary studies results of tuberculosis test of total 10 examined suspected animals by the single intradermal comparative tuberculosis test. 4 animals was positive, 40% of them were positive to bovine tuberculosis. Out of these 4 positive cases, there were 3 females, 75%, and 1 male, 25%. All positive animals revealed an increase in the thickness more than 4 mm and greater than the avian PPD at the bovine sides. The results of tuberculosis give a positive results and indication to proceed to another survey on the camels that slaughter in the apiary to study the actual situation of tuberculosis in camelids in the country. And the results of veterinary service, the distribution of lesion and the severity of the disease were established in 24 camels with suspension lesion. On the basis of cross-pathology, the prevalence of camel TB was 48%, and the TB lesions were seen in the lymph nodes and lung loops of the examined animals. This is the tubercle, and this is the lesion of the suspected lesion of the TB. And the preliminary examination of the tissue with the xenolsin stains show red colloidal or bacillary cells occurring singly or in clumps. Histopathological changes in lung and lymph nodes were most frequently affected in all affected camels. Lung section revealed typical extensive caseonecrotic lesion. Most cases affected camels showed tubercles and characterized histologically by granuloma formation and with infiltration of epithelioid microphages. and also lymphocytes, plasma cells, and neutrophils, central caseous necrosis, and some calcification we've seen is in some cases. Only few giant cells were seen in some sections. The Nelson staining of the section revealed variable, with some sections revealing a few acid-fast bacilli. This is the low power of histopathology, showing the, this is the area of connective tissue surrounding the lesion. And this is high magnification, showing the epithelioid cells and only few giant cells. There is some here. And also, the last section is the fully calcification of the lesion. For the microbacteriological results, the mycobacterial growth was observed in 50%, 12 of 24 of the samples collected from camels with the grossly suspension TB. Colonies were dry, rough, raised, irregular with wrinkled surface. They were creamy white initially, becoming yellowish or puffy colored on further incubation. This is the molecular characterization of the isolates, and 2 of these isolates were confirmed to be members of Mycobacterium tuberculosis complex, and none of the isolates were Mycobacterium avium complex. Discussion and conclusion. There is a large paucity of information on the pathology and the causative agents of TB in camels of pastoral region in the country. Therefore, inspection of pathology of camel's TB and identification of its causative agents is important to encourage the efforts in the control of the disease and reduce its risk of zoonosis to the pastoral community of Iraq. This is the first study confirmed camelids TB in Iraq by clinical and laboratory approach. And the prevalence of camel's TB recorded by the present study is higher to the previous study in United Arab Emirates and also in Egypt. The results of tuberculosis proved that the TB was more frequently observed in she camels than in he camels. And also, in conclusion, this is the preliminary studies, and the author hence recommends further future studies to identify and camels in Iraq, which would be useful towards the efforts made to control TB in camels. Thank you very much.
Thank you.
This is the report.
Great. We have time for several questions, if there are any from the audience. Yes, there's a lady here, please.
I would be interested to know, but by the way, thank you for this great speech. Is there any information regarding the incidence of tuberculosis in the human population in Iraq?
Actually, according to WHO, Iraq high incidence of TB, especially after the Iraqi sanction and after the war. And there is a lot of people, they are suffering from TB now. Yeah.
Thank you.
Okay, welcome.
There's a gentleman at the back.
Do the camels show any indication that the TB lesion is being capsulated, or is there any calcification in the lesion? These are things that seem to occur in other animals and in cattle in particular.
Do you mean in camels or in other animals, in bovine or in sheep?
No,
or?
in camels.
In camels, yes. Actually, in this study, we did find some lesion it's calcified, and some lesion it's still not calcified. So we find variability in the lesion.
Yeah, sorry, someone stretching at the back. I thought they were raising a hand. Could I ask, you mentioned there is a high prevalence of, or high incidence of TB in humans in Iraq. Is that thought to come from cattle or from camels in particular? Which species is thought to be the major origin of TB in humans?
I think it's from bovine, camel, from
yeah.
bovine. It's from
Yeah.
bovine. because the camels is out of reach of
Yes.
the people.
Yeah.
But it's the incidence, I think, in pastorals and nomad peoples is high in.
Good,
in
thank you. And
for
there's a
camels.
gentleman.
Yes, I must say I've seen in Africa, but also in Europe, tuberculosis coming from human infecting animals and humans being the reservoir. It is also true in zoos in Europe where, for example, monkeys are protected from humans by windows so that monkeys are not infected by tuberculosis or other diseases from humans. It happens that the source is occasionally not the animals, but the human infecting the animals, and this is also important to look at.
Actually, I do agree with you because for camels, I thought the human is the source of infection for these camels, not the camels, but because it's distributed, that's why we don't know. That's why we have to investigate more and more too. But I do agree with you. The humans is the source of infection for camels, for these camels.
Great. If there are no final questions, thank you very much for attending this first session. And thank you, Dr. Sanhausen.